my name's Katya. I'm doing my NG2 validation today. I'm going to start off by washing my hands. I'm going to provide privacy for my patient. Hi, my name's Katya. I'm going to be doing your NG2 feeding today. Are you feeling any pain? No. All right. So I'm going to go ahead and identify my patient with two patient identifiers, name and date of birth. And we're going to go ahead and bring the bed up to a comfortable working height. Are you able to lie flat? Did you have any allergies? No. Patient is able to lie flat and does not have any allergies. I'm going to start by assessing the abdomen. And only exposing what's necessary for the assessment of the abdomen. All right, so I'm assessing for any distension or any abdominal masses, and upon inspection, none noted. I'm going to auscultate. I'm looking for bowel sounds, 5 to 35 per minute, gurgling. If I was unable to auscultate any bowel sounds, I would listen for a full 5 minutes per quadrant. All right, now I'm going to just lightly palpate for masses and distension. Are you feeling any pain? And any rebound tenderness? When I pull my hands away, let me know if you feel any pain. No. All right. Very well. All right, so now I'm going to bring the bed up to a 45-degree angle. Okay. Now I'm going to go ahead and measure the tubing. Gathered my supplies. And the medical record states that it was measured in centimeters, so I'm going to measure in centimeters again and ensure that it is the same length. All right, so it's 64 centimeters. Verify that with the chart that it was 64 centimeters long. I would also get the patient for a chest x-ray to ensure that the tube is in place and hasn't been dislodged. Okay. So now I'm going to aspirate gastric contents and check the pH. I'm going to start by kinking the tube and aspirating 5 milliliters of gastric aspirate. And checking the pH, ensuring that the pH is less than 5. If the pH was more than 5, we would have to inform the provider. Now I'm going to aspirate the remainder of the gastric contents. And we want less than 250 cc's or milliliters. Otherwise, we'd have to inform the provider. And I would continue to do this until the gastric contents, until I got nothing else back. Okay, so I would measure, ensuring that it's less than 250 milliliters, and then I would also pour that back into the patient's NG tube before performing the feeding. So per se I got 150 cc's, I would pour that back in and elevating or bringing it down depending on if the patient feels any pain. If the patient felt any abdominal pain or cramping, I would hold it down. Once that got down and emptied, I would flush with 30 milliliters of normal saline. Now I'm going to verify the order for the correct feeding. I'm going to check the expiration date and make sure that it hasn't expired. I'm going to clean the top, and I'm going to prepare the patient for the feeding. I would provide the feeding up to what the physician's order noted and continue the feeding by gravity, bringing it down if necessary if the patient was complaining of any pain. I would continue the feeding until the ordered amount was done. Once that's completed, I would flush the tubing with 30 milliliters of normal saline. Now I'm going to kink, remove the tube, the syringe, clip, and put it back. I did forget to drape my patient with a check, but I would do that to protect the patient from getting soiled. And that concludes NG tubing. Thank you.